Hey, what's up, you guys? Thyroid disease. So thyroid disease, it could be hypothyroid or hyperthyroid. So let's talk about them. Hyperthyroid should be a simple, easy one, and hypothyroid. Let's put that. The hyperthyroid usually tachycardia, diarrhea, heat intolerance, increased deep tendon reflexes, atrial fibrillation, all of these things. Usually the thyroid starts from the TRH, thyroid releasing hormone, and then goes to the TSH, thyroid stimulating hormone, gives us the T4 that produce metabolism and mentation and way more stuff. So hyperthyroidism, how do you diagnose that? Usually, okay, low TSH, high T4, okay? The best way to diagnose it, radioactive iodine uptake. There are different types of hyperthyroidism. Let's talk about it. Zoom a little bit. Okay, there are different types of hyperthyroidism. Could be Graves, could be multinodular goiter plus toxic adenoma. These are about the same and confuse it with factitious and stroma ovarii. They usually confuse it because usually female having hyperthyroid symptoms, factitious and stroma ovarii. Ovary produces thyroid, factitious is like taking thyroid medicine. Okay, so this is the hyperthyroid. Can cause exophthalma, pretibial mixed edema. This is for Graves' disease. And how do you treat it? You treat it with thionamide, PTU, or methimazole. Okay, PTU, methimazole. And then we have something called Thyroid Storm. Thyroid Storm could be AFib or shock, could be fever more than 104, could be hypotension, altered mental status. So it could cause all of these things. When you have all of these things, this is a thyroid storm. So this is very dangerous. Why do you do that? What do you do? How do you treat it? First, IV fluid plus blanket, and then you give propranolol, then you give PTU or methimazole, one of them, and then you give a steroid. And then you can even consider surgery for Graves and radioactive iodine ablation for multinodular goiter, toxic adenoma, and stroma ovarii. So these are the things. How do you manage for hyperthyroidism? Okay, for hypothyroidism, what are the symptoms? Usually present with bradycardia, constipation, cold intolerance, decreased deep tendon reflexes, weight gain, opposite of hyper. Usually high TSH, low T4. Usually couldn't be, most of the time, cause iatrogenic after surgery for hyperthyroid. Could be Hashimoto, could be many causes. So regardless, you don't care you don't treat it differently based on what it caused. It's not like hyperthyroidism, like if it's Graves, you treat it with PTU, methimazole. If it's stroma ovarii, toxic adenoma, you treat it with radioactive iodine ablation. This one treat is the same. Just give them what they don't have, which is levothyroxine. Okay, except there's only one note, small note. If it's subclinical hypothyroidism, usually when TSH more than 10 or symptomatic, then you give levothyroxine. Okay, there's other thing is interesting too, is that when you have mixed edema coma, just like thyroid storm, mixed edema coma, basically they have coma, hypothermia, and hypotension. So what do? You do IV fluid, blanket, and give them thyroid 2423. So you just replace the thyroid hormone. Sorry. So this is simple. Hyperthyroid, based on the cause. If it is toxic adenoma, multinodular goiter, you give radioactive iodine ablation after the propranolol methimazole. If it's what is it called? If it is Graves' disease, you can do surgery. And it's called propranolol methimazole steroid. And we know the symptoms of thyroid storm, hypotension, fever, ultimate status, AFib. Hypothyroid, give them thyroid. If it's mixed edema, coma, give them IV fluid and a blanket plus the thyroid. And that's a summary for hypo, and hyperthyroidism. Thank you so much for listening.